The third key to a successful treatment plan is accurately completing your clinical preferences and prescription. If you go to your profile on the portal, you will find the clinical preferences section. Here you can set up directions for all of your cases. For example, this doctor would like to place attachments starting at step 4 for all of his cases. As you can see, completing this section can save you time in the long run. Also, please make sure you're clearly filling up your prescription and show it to your staff so they're familiar with its layout. Most importantly, make sure to convey your treatment goals clearly. Sometimes just writing resolve crowding is enough, but if you want to correct glass, achieve space for an implant, or any other specific goals, it is important to be as detailed as possible. These are all great prescriptions that give the technicians the information they need. Do not forget to indicate teeth that are included in bridges or ankylos, as well as implants since we can't move them. Also, please avoid placing attachments on crowns, veneers, and facial restorations, since they can be dislodged or get damaged during treatment. As you can imagine, this may aggravate the patient and extend the treatment time. Finally, please mark all teeth that will be extracted prior to starting aligner treatment, so we don't incorporate them into the treatment plan. A word on elastics and additional appliances. You may have seen this predictability table in other videos on this series. This indicates the amount of movement we can create before it becomes unpredictable. 3D Predict provides you with an extensive range of movement without the need for bands or any other appliances. For example, for glass correction, usually 2.5 millimeters of posterior distalization is needed. 3D Predict actually gives you up to 3.5 millimeters. So unless you're treating a severe class 3 skeletal case that you want to get closer to class 1, which I really don't recommend you do, you will not need additional appliances. Still, rest assured that our expert technicians will let you know if appliances are needed. Finally, please be pending on your technician's comments. Your technician may need to communicate to you a question about your 3D plan, a concern regarding your patient's anatomical limits, or clarify a specific movement you want to achieve. Regardless, we have noticed some of our customers miss comments, which can delay the treatment.